Myself, Dr. Vikas Sharma, Chief Neurologist, Neuro Super Specialty Center, Amritsar. Today my message is for epilepsy patients. Epilepsy is a common neurological disorder in developing countries like ours. Researchers have shown that 80% of the epilepsy patients are in developing countries like India. And out of this 80%, it is very pity that 60% do not get proper medical advice. In epilepsy, there occurs repeated fits. And there is an overload of electrical activity. There is a surge of electrical activity in the seizure. And for a moment, all the messaging system between the cells gets halted, gets disrupted. Epilepsy is not a stigma. Epilepsy is not a curse. As it is commonly thought, it doesn't stop anyone in getting whatever he wants to get in his or her life. It doesn't affect a person's intelligence. People can achieve whatever they want to achieve if they have epilepsy. It doesn't stop them from achieving, from fulfilling their dreams. If your family member or your loved ones have epilepsy, you should know what to do during an attack of epilepsy. If someone in front of you has a fit or has an epilepsy attack, you keep your head cool. Don't get pressurized. Keep your head cool. Keep a person safe till the seizure stops. Move things out of the way of the patient. Remove the glasses, remove his tie, remove his scarf, and remove anything sharp object nearby. If there is any sharp object nearby the patient, remove any sharp object so that during a fit, patient may not get hurt. Keep the patient on her side so that any saliva or any secretions from his mouth can flow out and it doesn't choke him. Place some soft pillow under his head and time the seizure. Generally, a seizure activity stops in a minute or two, so don't get panic. He's going to be seizure free after a minute or two. And if someone gets a seizure attack in the public, clear the ground, remove the people around, so that there is a clear ground around the epileptic patient. Don't restrain the person. Don't try to stop the seizure. It will cease itself after a minute or two. Don't try to put anything in the patient's mouth. It can injure the patient. Patient is not going to swallow his or her tongue. So don't try to put anything in his or her mouth. Don't perform any artificial CPR until or unless his respiration or breathing stops. He will be seizure free. Don't offer any food or any sips in his or her mouth. It can choke the patient. So after a minute or two, when a seizure will stop, the patient will get up. Patient will wake up. He will be somewhat tired. He may have vomited. He may have passed his urine. So don't embarrass the patient. Respect him. Even if he has vomited, even he has passed urine in his clothes, even he may bite his or her tongue, blood can come out. So try to respect him. Try to clean the patient. Stay as long as with the patient. Try to reassure the patient. So always discuss about your disease, about your problem with your doctor. There are a lot of causes of epilepsy. There are multiple causes: brain infections, brain tumors, some birth defects, congenital malformations, stroke, head injury, toxins. So there are multiple causes of the epilepsy. Always discuss your problem with your doctor. And always, every epileptic patient should have a epilepsy card in his or her patient, in his or her pocket. Every epileptic patient should have an epilepsy card in his or her pocket, on which about his disease should be written, what medication he is taking should be written. So anyone if around him, so in case a patient has a seizure, people around him can help him. Women with epilepsy can lead a normal, happy married life. They need not to avoid marriages because of their epilepsy. Even with epilepsy, they can live normal married life. They can have children with the proper medications. It's not going to affect their offsprings, their children. So they need not to hide their disease. They need not to hide their disease, because this disease is not going to stop them from leading a normal, happy, married, productive life. It is a common myth that the people with epilepsy should not be in the jobs of responsibility. No, they can be in any level. They can manage anything in their life. So they can handle all the jobs of responsibilities. They are not anything less than anybody. The most of marriages are pre-arranged. People generally think that patients with epilepsy, they are less worthy of a marriage, but it's not that. People with epilepsy are equally worthy. They can do what a normal person can do. So they should not be valued less. They should be respected, given proper due in marriages. People generally believe that epilepsy is the punishment of his or her sins which he or she has committed in his previous life. It is not that. It is not any punishment. It is nothing to do with any religious aspect. It is simply an excessive discharge of neurons in the brain. It is not a punishment at all. It is not an effect of evil spirits at all. Epilepsy is not contagious. It is not like a cold or flu. It cannot be transmitted from one person to other like a cold. So you need not to worry about spending a time with the epileptic patient. You can spend time with the epileptic patient. It's not going to spread just by talking or spending time with the patient. If you are a mother with epilepsy, it doesn't mean that you cannot deliver a healthy child. Yes, you can deliver. A female with epilepsy can deliver a healthy child with proper advice from your doctor and with the proper medications a doctor prescribed to you. So, a woman with epilepsy can deliver a healthy baby. It is a common myth that a patient with epilepsy cannot hold a responsible job. No, he can. With the proper medications, patients can get complete control of their seizures and they can hold any responsible job they want to hold. Any queries or any information regarding epilepsy, you can always email me at vfortis.doctor@gmail.com. You can call me at 8146758205.